Hi everyone, thanks so much for joining us. So my name is Kieran Cummins, I'm a researcher here at Demos, and I'm joined by our project partner on this research, the Internet and End of Life, Margaret Doherty from the Centre for the Art of Dying Well. And Margaret, do you just want to go around and maybe intro our panelists?
Of course. Thank you, Kieran, and thank you everyone for attending. We're well represented here today. We've got guests from universities, charities, hospice, public health, bereavement support and research, and the NHS, amongst others. And a special thanks today to the Plater Trust, who funded this research. And I know that Philomena Cullen and Kevin Ambrose are attending today as well. And also special thanks to the advisory group, Dr. Catherine Mannix, Dr. Amy Gaddu, Jim McManus, Karen Sanders, and Gemma Hobcroft. And so without further ado, I will introduce you to our wonderful panelists. Eleanor Jane from Sue Ryder, Baroness Finlay, and Dominic Carter from Hospice UK. And I will hand you straight across to Kieran Cummings, who will give us a summary of the findings.
Great, thanks so much. So I'm just going to share my screen now, give you a few slides. Okay, is that showing up for people?
Yes.
Yeah, great stuff. So at Demos, we're a think tank that believes it matters that voices and stories that aren't often heard in policy debates are brought in. And at Chasm, which is kind of Demos' digital hub where I work, we're always looking at how technology can offer new ways to do this. And this project with the Centre for the Art of Dying Well at St Mary's University was such an effort. We wanted to listen to people with life-limiting illnesses, those who care for them, and people being bereaved. And we wanted to identify why people turn to online spaces, online forums, to talk about issues related to death and dying. What are the needs that they're meeting, and how can these needs be better met? And this, as practitioners have told us, can shed new light for those who try and improve end-of-life care. And I just want to briefly acknowledge, these kind of topics are difficult enough to discuss at the best of times, but of course, acutely so right now. And there may be people in the audience, and indeed people in this panel who are affected by these issues. And we're going to try and do everything we can to approach this topic with sensitivity, of course. So how did we do this? Well, we collected public posts over a long period, including during the pandemic. And we aren't naming the forums, but they included large social media platforms, more general community spaces, and also specialist forums that are dedicated to discussing, for example, bereavement. We do this kind of research with the University of Sussex using a suite of tools that allow us to examine large text data sets. So why do we use this and how? Well, these are really big discussions, right? As you can see, over 100,000 posts. These kind of sources overwhelm comprehension. So we train an algorithm to look for patterns of language as a human researcher would, and we then can analyze samples of that more closely. And what came out? Well, this is a snapshot of conversations. Obviously, people are talking about all sorts of things, but these themes here at the bottom really were prominent, and they speak to this question of what are people seeking. So we had discussions of care and the care system, people's experiences of grief, people discussing mortality and life after death in a slightly more abstract way, in a term we call existential discussions here. And we've also found people reflecting on the value of these spaces, which, as you can imagine, is a tremendous insight. And prominently also people discussing pets, both pets that they've grieved for and as grieving companions. And across all of this, three things came out about what people are seeking. So these are comfort, capability, and community. So why do these themes matter? Well, first of all, of course, they resonate. Practitioner workshops we did, people would tell us how these are exactly the things that people are seeking, say through counselling and different kinds of support. But what matters about this research is not confirming what those experts already know, but expanding our understanding of how these needs can be met. In this case, online, but also where they are being curbed offline. That's the kind of insight we get from people talking about, where say services are failing them elsewhere.
Kieran, I'm very sorry to interrupt, but the mic is very muffled. So I don't know whether you might be able to speak into a different mic, or if anything else is possible.
Yes, okay. I'll try one thing. Is that coming through better?
Yes, that's better.
Okay,
Thanks.
Could you, great, thank you. Sorry about that, everyone. So let me just minimize this. So as I say, we have these three themes that came out across the research in terms of what people are seeking: comfort, capability, and community. So comfort, well, online spaces are undoubtedly providing comfort that can't be found elsewhere. But at the same time, this does highlight, this research, an absence for many people offline. So for example, people talk about how they felt they had nowhere else to turn to offline to find comfort in their grief. But in these spaces, of course, they're surrounded by people, albeit relative strangers, but people who have a first-hand experience of what they're going through. And then there's this theme of capability, which again ran across the conversations. So online spaces are clearly playing a key role in empowering users, but it's clear too from this that people are still facing significant barriers if they feel they're not capable elsewhere or feeling disempowered. So for example, people will talk about how these spaces kind of acted as repositories of collective knowledge for them. People discuss, for example, what it's like to go through grief at different stages. Carers would seek and give advice about the care system. And this kind of knowledge, this kind of wisdom that people were sharing seemed to particularly empower those who suddenly found themselves, say, caring for a loved one who's terminally ill, or maybe someone who's recently been bereaved. So these are valued resources for users, and new users would be directed by older users to particular spaces within forums, particular posts, particular other users who can be real guides. But this is also, of course, a reminder of barriers and people's disempowerment. And this came through really in discussions during the pandemic, as you can imagine, because when others are in the same novel situation, there's a limit to the advice they can give you. So here, as I say, people's disempowerment came through. People talked about the challenges of social distancing, the lack of or delay of communication from healthcare professionals. And finally, we have this theme of community. People we found are really invested in these online communities, and they work to build real relationships within them. One way that this came through is a real willingness to share personal details in a way that suggests mutual trust. And of course, there's privacy concerns here and safeguarding concerns about the people using these spaces. But when done well, it really seemed to provide people support and feel part of the community. People would encourage one another to share if and when they felt comfortable, for example, details about the person that they're grieving. And of course, interestingly too, again, during the pandemic, we found people reflecting about how these spaces provided something, i.e. community, which other kinds of online support couldn't. People talk about the limitations of a Zoom counselling session they had, or of visiting someone virtually in hospital. Online forums, by comparison, were praised by many of these users, not least for this sense of community. So online spaces are clearly meeting a need. They provide advice, solidarity, companionship, information in some cases. And in conversation with practitioners, the benefits really resonated, but so did, of course, the lack in people's lives that was revealed through some of the conversations people would have in these spaces. And it's clear, of course, that online spaces are not enough by themselves to improve people's experiences. So what are we recommending off the back of this? Well, I'm going to talk in broad brush strokes here, but three things really collate what we're saying. One is this idea of building presence. We need to increase knowledge and awareness of these online forums and spaces and their role both amongst users and practitioners. So for example, we need to increase signposting. One of the things we're suggesting is organizations providing support and care at the end of life, those who run and moderate these online forums, and indeed tech companies should work with the NHS to create a shared database of online forums for supporting people at the end of life, with details about who they're for and how to access them. Support access, this is absolutely key in all discussions of kind of online policy, but it really comes through here. We need to enable people who would benefit from online forums to be able to engage with them. And this is about tackling digital exclusion, but also building the digital capabilities of users, even when they're online, and of practitioners too, who may be using online forum in part of their supports. So in practice, this might mean helping community organisations that tackle digital exclusion, for example, amongst particular groups, where there may be perhaps language barriers, in addition to just being able to get online. And as I say, upskilling staff here to feel confident in sending people to these spaces and integrating them into their care. And finally, improving practice. We need to strengthen the evidence base here. We think that this research says a lot, but we think it's just the start about what role online services are best suited for in support provision. So we need to collate knowledge of best practice in delivering them. For example, we believe NICE should conduct an evidence review specifically of online forum support and develop a standards framework around this. So that was a bit of a whistle-stop tour, but I'll hand it back to you now, Maggie. And if there's anything you wanted to expand on, first of all, that'd be great. And then perhaps we can turn to our panelists to get their initial thoughts. And just a reminder to people, please do send in your questions and we'll address them in the Q&A.
Thank you, Kieran. Thank you for explaining the findings so well. I'd just really like to add that this project was born long before the pandemic, because we were really keen that really data drove all of our work, and that we really needed to know which forums people were communicating in, what was the nature of those conversations, what support they were finding, and what support they were looking for. So that's why it was crucial. We really hope that this research helps you with your ongoing work, your ongoing research, and your ongoing policy making. But I'll hand over to Baroness Laura Finlay to really ask what resonates most from this research within your own work.
Thank you very much, and thank you for asking me to be on this panel. I think it's interesting to think that this started as a piece of work before the pandemic, because the pandemic has really thrown the internet into everybody's lives in a really sharp way. And people have started using the internet differently. So one of the thoughts that went through my mind really was whether you saw a change in the information that you were getting in as the pandemic evolved, and whether you have a timeline whereby you're able to mark those changes that happened in society, because they were quite marked. Obviously, you picked up one of the ones, I think, over the visiting and the restrictions and the fact that digital contact is not the same as personal contact. In terms of their going forwards, if I can comment on each of the three areas. First of all, in having a presence in these spaces, moderation and safety is absolutely key. The problem is that these are vulnerable people, and the problem is that there are criminals out there, basically, who will groom people and exploit them, particularly for financial gain. And people who are vulnerable very easily get caught up and believe what they want to believe. And some of these grooming groups and scam groups are very clever at presenting things in a way that make it sound as if we're here to help you and to solve your problems. So I really would put safety around that building the presence and knowing how things are going, and the ability for people to feed in any concerns that they have as well, so that it isn't just moderated, but it's actually being evaluated as it goes. In terms of access and support, I do have a question really for you about how many cries for help went unresponded to. I think we've got a huge problem that we've ducked for, well, decades actually, and that is that healthcare services are available for a quarter of the week. I think it's 24.6% in fact at the time. And yet people, particularly with progressing illness and who are seriously ill, have things happen at all times. I've said before, disease does not respect the clock or the calendar. And if people are going online and expressing a need for support and a feeling of being let down, it almost goes into a big black hole if that's no way of that being responded to and picked up. And actually, I think that all of the services, health and social care service and everything, have to look at how they're going to respond, going back and responding back to provide the support that people need. You talk about improving practice and the role of online services. I think if online services aren't linked up to the other bits of health and social care, often the practical, physical support that people need when somebody's at home, then inevitably that chasm may widen and become like the Grand Canyon. Because people, if you've got someone at home who is difficult to move, people need to know and actually have somebody come and help them move them, changing the bed, helping somebody to toilet, or if someone's had a fall, actually being out there fast and picking them up off the floor is really important, and not leaving them even for an hour or so when things can really deteriorate. You spoke about NICE and standards. I'm a little worried that there isn't enough of an evidence base out here yet to build on. NICE does evidence reviews, it looks in depth at what there has been, but I think the field is changing so fast, and I'm not aware of studies that have done proper comparisons between using online ways of behaving generally versus non-online, and then evaluating those separately. And until that's done, I worry that we might be fooling ourselves to think lots of people will jump into this online space, but actually will be leaving the unmet need as unmet need. So I know that sounds a bit pessimistic. I think it throws up enormous challenges to people, and at the end of the day, the services could be better, much better, and better focused to meet people's needs, rather than providing a menu of this is what we do, turning it round and saying, what is it you need? And this is a way that we'll provide it. And there should be room and space for people to be much more imaginative with solutions as well. So that's my quick commentary, or not so quick. Thank you, Maggie.
Baroness Finlay and Kieran, we're very happy to speak into that now in terms of giving you the brief headlines. In terms of when you spoke about during the course of the time period, which was actually 2004 to August of last year, the volume and veracity became much higher, obviously, in last year, and particularly in August 2020. And in terms of the themes, obviously grief became a bigger area towards the latter part of last year, and people were finding peer-to-peer support during that time. In terms of when people are asking for that support and whether there is an unmet need, I wouldn't mind bringing Eleanor in on that point as well, because Sue Ryder do some wonderful, wonderful work in their online support forums. But people were crying out in the middle of the night, and that's something that Mark Hazelwood has put into the chat. And in peer-to-peer support forums, people are very, very generous with their time, but there is always an unmet need as well. And so Kieran would speak into the need for signposting as well, so that people are directed to places where they will meet that and find that support at the hour that they need. Eleanor, would you like to speak into the work that you do in that area?
Yeah, sure. Thank you very much. So, Sue Ryder, we've got an online community for people who are bereaved that we've been running for 6 or so years now. It was, and I think this is interesting in the context of wider service provision, it was originally set up designed to support people who were approaching the end of life and their carers and families. However, it quickly evolved into very much more a support for people who are bereaved. So our reflection on that was that this is how services are provided. that when you are in palliative care, you get fantastic, if you are lucky enough to receive palliative care when you're at the end of life, you're in fantastic services and get that holistic, or you should be getting a holistic wraparound support for you and your family and loved ones. But when someone dies, those services quickly disappear, and the people who are left behind are really left in this really difficult position where everything just disappears overnight, and all the support they may have been getting from wider palliative care teams is largely gone. So this is, I guess this is where our online community really comes in, is providing that support when everything else disappears overnight. And then to reflect on what you were saying, Baroness Finlay, about the hours, that's the time of day, and that's where online communities really come into their own, that they're used so hugely out of hours when people are, don't get support from other people in their lives and from other more formal services. So we see our online community as very much part of the whole mix of different types of support and services that people could or should be able to access when they're dealing with a bereavement. So it's very much an informal community that we provide. And obviously there's a range of services that are informal, just from what the support that people can get from friends and family, through to all the more clinical and formal supports that people can get when dealing with bereavement, or should be able to access when dealing with a bereavement. So it's very much part of that whole mix, and it's all very much about developing a compassionate community, the type of community that has been discussed over recent years in the world of policy and is starting to evolve very much on the ground. It's that sort of grassroots, so people supporting each other through difficult experiences and using their own experience and skills and knowledge to support others. And that's what's really powerful about our online community as well. And I think that has shown just how powerful it is, because over the last year, the number of people using it has gone up considerably, around about 22% more users. But like comparing this January to the previous January, it's over 60% more users using this service. So it just goes to show how valuable the support is. But there's loads of issues in your report that resonate with the way that we work. So one of those is that, well, I suppose in contrast to what you were saying about a concern about people being excluded from this type of service because they're not online or don't have the digital skills or knowledge to be able to use this type of service, we actually saw it when we set it up, certainly, as an expansion and a growing our services and expertise to be able to reach more people. So previously, our bereavement support services would be delivered in the localities around our hospices. So for people who'd used our services who are in that local area. But creating the online community actually expanded it massively and meant that we could use what we knew as a bereavement support provider to provide support on a much wider basis to people who would not have access to our services, or potentially the other services provided by other hospices if they don't happen to live in those local areas. And then again, it's that whole 24/7 access that makes such a huge difference. That's not to say that it's been plain sailing having set it up. There's lots of things that we've learned along the way, and there's issues like moderation and safeguarding that you touched on, Elora, and that are touched on in the report as well, that we are keeping under constant review. So we do have a team of paid moderators and volunteer moderators, which I think is really interesting. It's people who want to volunteer for Sue Ryder but potentially can't do it in a particular place but can do it online, which has been brilliant, and I've learned from their experiences of using our services. So we have that team of moderators, and we have a clear safeguarding policy so that when people are in distress, we know we have a process for escalating that and signposting, etc. So there's lots. So it's not just this sort of peer-to-peer support. It is also very carefully managed to make it as safe a place as possible. One of the things that came out, obviously, in your report was just the role that pets can have, both in terms of impact on someone when they die. But also, what we found a lot of in our online community is what an important role pets and animals have in terms of helping people recover from grief from someone in their lives. So that's been really significant to us. And indeed, we have just launched a campaign to recruit some dogs for therapists. So, the ambassador dogs that we're recruiting as we speak. So we do recognise just how important all these things are when it comes to starting to help people recover or sort of go on their journey through grief. So I think there's so many different strands of what your report picked up on that we have maybe a slightly different view of or different experience of, but all are very resonant. And another thing that you did reflect on as well was the role of sort of regulation and having certain standards, and that's something we'd definitely be up for exploring. I think because we know that there are forums out there that aren't as carefully moderated or don't have the safeguarding policies in place that we do, so are aware that that could be dangerous for some people or a risk to some people, so would be keen to explore that further with you. So that's the Sue Ryder take on your report to date.
Thank you. And for those who haven't had a chance to read the report, it's both on the Demos website and the Art of Dying Well website. And totally agree with you that pets as therapy, we need more of them, and it makes all of our day to see the companionship that pets bring to the lives of those who are grieving. Dominic, over to you, and the view from Hospice UK.
Yes, good afternoon, everybody. Hi, I'm Dominic. I'm the Head of Policy and Advocacy at Hospice UK. And for those that aren't too familiar with the organisation, we have hospice members right across the UK, but actually our kind of main reason for being is to try and ensure that the end users, end beneficiaries receive the end-of-life care that they need. I think this report is fantastically timed as much as anything. As Laura said, the fact that it's kind of come out at a time when our use of the internet, whether we're involved with end-of-life care or not, has really exploded. Means that this report is essential. I think it's key in looking at how we help to break down taboo around death, dying, and bereavement. I think the conversation around death and dying is something which, for decades, many of us on this call have worked to try and work out how best to approach this with people, how to encourage more conversations. I think a part of the clear value of these spaces for many people is exactly that they're informal spaces. The communities can develop freely, and that people can collectively determine how they use and run that space. Clearly very important that people can feel confident to be able to use the language that they're familiar with, express feelings or ask questions in that supported environment where others know immediately what you mean without need of explanation or something that might make you feel a bit vulnerable. There's an ongoing need to demystify those conversations about death and to build public understanding around people's experiences and needs of end of life. And this work comes at that very important time when we think there's been a shift in public consciousness of death and attitudes towards talking about dying. So now over half of UK adults now said they feel comfortable talking about death and dying with those around them. And recent polling that we carried out with 3,000 UK adults suggested that there's been quite a shift caused by the pandemic in how people's attitudes are towards taking action towards dying, with a quarter saying the pandemic has made them more likely to have casual and informal conversations around preferences of death, or being more likely to express their dying wishes. And I think that kind of summarises a bit of where some of this report is going in terms of saying, well, actually, there are a lot of people out there who are ready and willing to talk about death. And I think we need to make sure the environments are there to be able to nurture that and to ensure that people feel they have that safe space. I think perhaps of the greatest concern that the report highlights, and I think it's great in which it kind of weaves across the informal and the formal, is to think about I guess that the report's link that some people turn to online communities because end-of-life care isn't working for them, that some people feel disempowered, not listened to, or are struggling to navigate the system effectively, as the report says. So there's people that are coexisting who are finding that they're not getting the care they need with those who perhaps require a lighter touch benefit from the online community. And I think it's very important that end-of-life care providers, commissioners, and the system puts in better mechanisms to be able to identify and spot who those people are and make sure that we're reaching out to them, so that as previous speaker said, they're not sort of having their concerns and their worries not answered, and are falling into a position of distress. I think we're probably at a bit of a crossroads. In 2020, about 700,000 people died across the UK, with an estimated 3.5 million people bereaved. And there's clearly very well documented backlogs and sort of very exhausted staff right across the sector. Even before the pandemic, around 1 in 4 weren't receiving the end-of-life care they need. And sometimes online platforms and signposting can be seen as quite a quick and easy offer, but isn't always the right one. I think if you look at the latest sort of data that's been released around episodes of care, you can see that there's a huge increase in the number of people requesting support, but actually the number being offered that hasn't changed a great deal. So people are being pushed into different places and different corners. And I think we need to be careful that online communities don't act as that purely, that net for everybody. Clearly a time and a place for them, but I think can't be a replacement for more formal help. I guess the other part is that people clearly care about these spaces. I think the flip side to that is to make sure that we recognise that these are real places, that these are things that people are actually valuing, that they are putting their time and energy into investing in and helping to build them themselves. So I think we have to be careful that we don't kind of over-healthify some of these spaces, if you like, and actually kind of storm in dictating what needs to be done, how things need to be moderated, ensuring that people can keep that same level of flexibility and freedom. And I think we'll come back to this, but that's particularly important for people who are perhaps already marginalised by health and social care services, those who perhaps live on the edges and don't feel like they are included, that they are kind of given the opportunity to shape their own safe spaces to be able to talk. And I think, again, during the pandemic, we've seen a significant amount of that. So I'd say that we shouldn't be overly prescriptive and should seek to stop short at kind of pushing around symptoms and clinical need, and to think to encourage input and links to wider aspects of life. And I think the report picks up greatly, as Eleanor says, on the side around sort of pets and religion and those wider aspects of what are important to people. And I think that forums are great in kind of giving people the opportunity to really explore that and to branch out.
Dominic, thank you. And I'm really struck by what you say about not over healthifying.
Not sure that's an official term.
That those who don't feel that they are included in the system, that these are safe spaces where they can share with others and be inspired by others and help others as well. So thank you for that contribution, and thank you for taking part in the panel today. We've got 20 minutes left, and I think it's important that we hear from you. If you would like to post a question in the chat box, please do. Following on from what you said, Dominic, Dr. Catherine Mannix has said, I've observed in many online discussion groups concerned with supporting grief, support for families, carers for people with dementia, end-of-life care, other illnesses, that they don't see their forum as a replacement for services they expected but didn't receive from statutory services, but rather that this is self-help, that they are proud to use and provide as an act of personal empowerment. They are outside the system and like it that way. Did this come across in the research? Would users want to use online resources provided by statutory providers, or is that a different entity? Kieran, can I hand that one over to you?
Sure. Yeah, no, it's a really great question, and hopefully, and not in a contrived manner, actually touches on some of the things I wanted to say in response to everyone's comments, which is so insightful. Thank you. So I think, that is one of the things that I think comes across here a lot, and we talk about this in the report, of a kind of central tension, basically, which is, I think, Dominic, as you kind of put it quite well there, kind of basically balancing the positives of the kind of informality of these spaces and all the benefits that brings, with all the risks that, as Eleanor and as Laura, as you mentioned, about moderation and the fact that there's lots of very vulnerable people in these spaces. And I thought, Laura, your point was particularly pertinent, because there's been, outside of discussions of end-of-life care, there's been lots of discussion recently in the news about the rise in scams, of online scams, and that this is something that current legislation that's going through needs to deal with. So it's a really live, it's been a live issue for a long time, but it's really clear that people's vulnerability can definitely be taken advantage of in online spaces. But yes, going back to Catherine's point, balancing these two things is a central tension. And what we say in the report is, you know, we don't suggest we can resolve this, right? And that's precisely why there has to be really, I think, the kind of precaution that actually, Alora, you mentioned as well, of you kind of said, you know, we have to have imaginativity about the solutions here. We can't suggest that we've solved exactly the question of what these spaces are for, if they are for anything, and we can just roll that out and apply that to people rather than working with people to understand, do they want that support, and if so, how does it slot in aside the other care that they're getting? How does it integrate? And I think one of the things that's really key there is, again, something that you mentioned, Dominic, is this kind of exploratory nature of it. So people should be allowed to kind of have a lot of choice. So there needs to be signposting, particularly for people who, you know, if people are moderating these spaces and it's clear that maybe someone does need more support than can be provided in these spaces, they need to be helped to directed to other support. But there needs to be choice involved in that, of course. And it's getting that balance right and exploring how you present things to people, how you signpost to people, how you integrate with other kinds of care, that I think is precisely why there needs to be, you know, kind of further research on this, and particularly to understand what that would look like in practice.
We've had a question from Mark Hazelwood to all the panelists, which is, are internet spaces used more out of hours, and to what extent is this a reflection of absence of formal services, or are people just looking for something different, additional?
I think in Sue Ryder's experience, that is very much about, it is out of hours is a really important time for people to use our online services. And I guess that is because they haven't got maybe more formal types of support that maybe they would be in receipt of the rest of the time. But I think one of the issues is that people turn to the online community for peer-to-peer support. And so it's obviously, you can't, I mean, unless things are really bad, you're not going to be phoning up your friend or your sister or something at 3 o'clock in the morning. So the online community is the place to go. But having said that, many of the people who use our online community, well, about a quarter of them, report having nobody else, no friends or family who they feel able to talk to. So for those people, actually, any time of day is the right time to use the online community. So it's actually quite flexible, and I think meets people's needs in different circumstances. So that's, I guess, the beauty of the internet, isn't it? That's how it works.
Indeed. And what do you think the pandemic has taught us about the use of online spaces in supporting people around end-of-life care? Baroness Finlay.
Yeah, I wasn't sure you were addressing that too. I think that we've got to look at different groups, actually. There are those who need support because they're caring for somebody at home and they don't feel the services that they need are there, so they need help with practical aspects. Sorry if there's a bit of noise in the background here. The other group are those who are actually providing the care, who need emotional support themselves and possibly validation of their own feelings. And that's different. So the person who's becoming exhausted and just wants to let others know that they're finding it difficult or whatever, or that they find comments from other people difficult, they don't know how to handle them. And often they're very, very simple things that can really wear people down. The person who phones up with an incessant amount of advice for somebody can be really wearing. And then there's those who are bereaved, and that's in a way that's where they're left with the gaping black hole of having provided care, and that's gone. And when people have been providing a great deal of care at home, that gap can be even greater, because their whole day and night has revolved around trying to meet the needs of whoever it is who is dying. That input tends to go up towards death. There's this sort of emotional, almost like an emotional explosion at the time somebody dies, of the overwhelming finality of death that often doesn't strike people until the person's actually died. And then they realize that there's the gaping hole, and all of those questions that they have of I wonder if and what if and should I have asked, and down to little things like wanting to know where something is, or what the password to something is, or what somebody's name was, and they suddenly realize the person who they would have asked isn't there anymore. And I think those are all very different types of needs, and there is a danger in trying to sort of lump them all together.
Very true, Laura. Very, very, very true. Did anybody else want to speak into that, Dominic or Laura, or Eleanor rather?
Yeah, I guess in terms of the pandemic, I think we've seen that it didn't affect everybody fairly. That it impacted on certain parts of the community more so than others. And I think off the back of that, it's been recognised that is in part because of the sort of systematic exclusion of some of those groups from wider health services and the barriers that they face. I think it's absolutely vital that as online communities continue to grow, as this sort of develops as perhaps another branch of support, whether it's informal, slightly more formal, moderated or otherwise, I think we need to be absolutely sort of from an early stage, be putting a lot of energy behind making sure that doesn't happen again here. And I think that we potentially in end-of-life care have an approach where, because a lot of support is good quality, quite often we say that, particularly in hospice care, that everything is open to all, that everybody is welcome, but actually that doesn't necessarily count if the service itself is structured on outdated and unsuitable demographic models. So I think it's thinking about, okay, how do we ensure those safe spaces exist? How do we reach out and recognise who's using these different forums? I know that we talked a little bit about, and the report recognises very well, like the different forms of online communities that exist, whether it's sort of condition specific that often exist on charity websites, whether it's social media, or whether it's something a bit more formal. I think we need to try and identify who is using each one, and actually, are we missing anybody at the moment?
That's so key, isn't it?
Maggie, sorry, can I make a comment building on that? Because Dominic, you triggered something I'd written down previously, but forgot to say, which of course that you focused on English language. And yet many people, when they are upset and distressed, find it much easier to communicate in either even their first or even their second language, but it's not English. And a lot of these things are structured in a way that you have to be familiar not only with the English language, but the thought processes that go along with it. So they're not intuitive and people feel immediately excluded. So the forum is in a way replacing what used to happen around in previous times, around the church, the high street, the pub, the mosque, the Gurdwara, whatever. But now it doesn't so much or at all. And the encountering of people and staying in groups has been fragmented during the pandemic, and all of that's made it much harder. But I think the power of people's own personal culture when they're distressed should not be underestimated.
That's very strong. The power of a person's personal culture shouldn't be underestimated, Baroness Finlay. Yes, it's in terms of in recommendations going forward, that's a key recommendation.
Margaret, I just wonder, because there's something running through both of those points, which I completely agree with, and I think something that's really crucial, and at Demos we've looked at this kind of in our broader work, which we kind of term as the good web, which is kind of what vision of the web should we have. We're very good at talking about what we know is wrong with the web right now, but we need a better idea of what it should look like. And a part of that has been around kind of the design of spaces online. And one of the things that's really clear, both that came through in this research, you'd have users talking on forums about, to the moderators or to the particular organization running this forum, saying, why can't the forum be like this, or could the forum be like this? And it speaks to the fact that if you give people more agency in these spaces to shape what they look like, then you can start to address some of these concerns, not completely solve them, because again, the internet here isn't the solution to that so much. As you said, Laura, there are spaces elsewhere, and definitely the route should not be to replace them with these. But I think that that's really key, and it speaks to your point as well, I think, Dominic, about recognizing that people will turn to the spaces, online or off, in their lives, whether that be a particular community, and of course just the people around them, their family and friends. And I think what's really clear with the pandemic is in this report we focus on online forums, but we do discuss kind of that in relation to other online spaces. And what's really clear is people have turned to all manner of different online spaces throughout the pandemic to find all kinds of support, not just around end-of-life care. So that be forums, social media, many people have their family WhatsApp group and that kind of thing. And then different age groups will have whole different spaces. TikTok, I'm aware that's a thing, but there is a whole, we don't talk about in this report, but that is a whole for kind of Generation Z young people, there's a whole space that we didn't have space to look at in this report, where people are discussing grief, and that's a whole environment again which we can't address, which is specifically for young people. So really, I think it speaks to this point about agency and ensuring that both for current online support around end of life and for definitely for any kind of future developments here, putting people's own choices and decisions as users is really central, because they know what they need, they know what they want, and they know how they can integrate to the best approximation the kind of communities they want elsewhere online as well.
And what was clear throughout was that people were and are finding comfort, care and community in these online spaces. And I remember one Boulder Eyes quote, which was that it's like having a fireside chat with friends. Another question to all the panelists is, how can government, health services and civil society work together to improve online support for the dying, those who care for them and those who are grieving? Baroness Finlay, can I start with you on that one?
Yes, there's a huge amount in there, and I think each of the different groups have got completely different roles. I mean, I could take a couple of hours, I think, to try and answer that. I guess if I can kind of encapsulate it, I find it incredible that we still rely on charitable giving to provide what is an absolutely essential core service to look after people at an extremely difficult time of their life. And then we expect people to put hands in pockets and come up with the money. Now, the government during the pandemic did come up with money for hospices, thank goodness, because otherwise many of them would have closed, I think. They would have gone to the wall. But it does seem quite inappropriate that we expect so much care to be paid for by the voluntary sector only. And I have a slight worry when we talk about choices, because actually the choice that the people really want is to not be ill in the first place and to not be dying. And the choice they would like is to be well again. And the choice that the people who are providing care usually want would be to not see the person who they love ill and deteriorating, and the choice of the bereaved is to not be alone very often. And that gnawing gap of grief, which is just terrible, and people don't understand, and I think often until they experience it, they think things will be over and easier. So basically, I think government has got to step up to the plate, and the whole of healthcare and society has got to step up to the plate and say, is this core, looking after people who are dying properly at all times of the day and night, 24/7, providing support people need, listening to them, meeting their needs? Is that core? And if it is, then we should get on with it.
I'd say that in terms of the culture, there is definitely a cultural shift going on now, and that's one of the very few good things to come out of the last 15 months or so, is that the pandemic has shone a light on death, dying and bereavement. And that does mean that as a society, as a culture, we're starting to make baby steps towards being a bit more open about grief and dying. But there's still an incredibly long way to go in order to be able to, for people then when they are in the grips of grief, actually feel supported by society, by the people in their lives and by the people that they come into contact with. So there's still such a long way to go. And I think that role modeling in civil society is going to be such an important way to help this along the way. So politicians should be able to speak openly in the media about their experiences of death, dying and grief. And so should everyone in the public eye should be able to feel comfortable about it, obviously, but only if they do feel comfortable about it, do speak about it, so that as a society we start to move it on a bit. And so that the online side of things doesn't need to be this thing that's slightly anonymous, but is part of this bigger mix where we're all more open about death, dying and bereavement. So I think there's such a long way to go, but I do think civic society has got a big role to play in that.
I think from my side, I would say that for government, they could certainly be doing more to try and ensure that people who need care receive formal care, and try and ensure that online support and communities are able to thrive doing the things that they know well, and trying to make sure that they have that space there rather than having to try and do multiple things to support people who actually need formal services. I think secondly, there's a role for the health service to link more closely with online communities. And I think it speaks to the final question in the Q&A, that the NHS currently have 3 online communities as sort of approved providers, if you like, one of which is a general health forum. And that's the only one. And it also has no threads or themes on end of life care or death or dying at all. So clearly it's linked into lots of different threads. So I think there's something to be said for making sure that different parts of the health service are linking with those online communities, enabling them to have the best information to hand, whilst, as I said before, not sort of taking over or reducing the flexibility and the freedom that people have to express themselves there.
Dominic, Eleanor, Baroness Finlay, thank you, and big thanks to Kieran too. I'm conscious it's nearly 1 o'clock, so if you had any burning comment to make, please make it now. And if anybody had any last minute question, please ask it now.
Can I just make a comment, Maggie? I think we've got to be realistic that the amount of money is not infinite, and that there are really clear decisions to be made. And if you've got core clinical services that are there when people need them, then I'm going to make a bid that goes to the top of the queue, and that then money gets spent after that on other things. But I really don't see how we can be spending money on funding online forums until we know that we've got appropriate nursing and medical care going into people's homes when they need it. And they often need it at nights, holidays and weekends. And that all counts as out of hours, and we've got to meet that need.
Very true.
Absolutely, and I'd just say, if it's not clear enough already, there's nothing in this report that's suggesting this should be a replacement at all. And indeed, as we say, as we recommend, precisely the need for further research into what exactly greater integration would look like is out of respect for the fact that we don't want this to be approached as a kind of replacement. And I think we've just come up to time, so I just want to add, alongside Margaret, thank you all so much for joining, both panelists and people who joined the Q&A. This event has been recorded, so it should be online. If you think there's others who may be interested. And of course, if please do direct them to the report, likewise, if you think that it may be of use or of interest to them. And otherwise, thank you so much for joining all of us. Thanks, bye all.
Bye.